Hi, my name is Mari Kirk, and I'm going to be talking about the vegetarian vegan diet and how it helps reduce type 2 diabetes. Diabetes today is at an epidemic proportions. There's an estimated 180 million cases worldwide. Forks Over Knives by T. Colin Campbell and Dr. Esselstyn have set a new precedence in research on plant-based diets. They're finding that plant-based diets has the ability to prevent and reverse some diseases. Today we're going to be talking about how type 2 diabetes and the vegetarian diet work together to reduce people's risk. The first topic I want to focus on is how the vegetarian diet decreases a person's risk in developing type 2 diabetes. Bernard and Ketcher did some research and found that the vegetarian diet has an adherence to the vegetarian diet over a 17-year period reduces the risk of developing diabetes by 74% compared to those that have a weekly intake of meat in their diet. Townsend and Associates found that the vegetarian diet is rich in fruits and vegetables, and because of promoting that vegetarian diet, you tend to ingest a third more of fruits and vegetables compared to non-vegetarian, and this results in a 40% reduced risk of developing type 2 diabetes. The research is also finding that eating a vegetarian vegan diet decreases a person's body weight, which impacts type 2 diabetes. Bernard and Ketcher took 20 normal weight men that are insulin dependent type 2 diabetics and placed them on a 10-day trial. And their diet intake consisted of 65 grams of fiber, 65 grams of cholesterol per day. By the end of the study, 9 of the participants did not need insulin any longer to treat their type 2 diabetes, and the remainder on average reduced their insulin use from 26 units a day to 11 units per day. Bernard and Ketcher also did a small pilot study that was 12 weeks in duration, and found that the effect of the vegan diet on type 2 diabetes had an association with fasting plasma glucose, which had decreased by 28% compared to 12% for the more conventional portion-controlled, energy-restricted diabetic diet. And thirdly, they're finding that the vegetarian diet increases insulin sensitivity in type 2 diabetics. The Journal of the British Diabetic Association is finding that a calorie-restricted vegetarian diet increases insulin sensitivity, reducing volume in visceral fat, and improved plasma concentrations, and oxidative stress markers more than the conventional diet found with type 2 diabetics. There was also a 74-week clinical trial done by Bernard and Cohen, and this found that there is a reduction in fat was strongly associated with insulin sensitivity, and that the fat concentration in vegetarians was on average 31% lower than the non-vegetarian. So the research is showing that a diet rich in fruits and vegetables decreases overall body fat, in turn increasing insulin sensitivity, which decreases a person's risk of developing type 2 diabetes. They're finding that the prevalence of type 2 diabetes increases from 2.9% in vegans to 7.6% in non-vegetarians. So in this fast-paced world we live in, of eating convenient foods that are high in fat and low in fresh fruits and vegetables might be a leading cause to the recent increase of type 2 diabetes, especially in Americans. So the research is proving that eating a vegetarian or vegan diet has a decrease in our overall body weight, which increases a person's insulin sensitivity and in turn decreases a person's risk for developing type 2 diabetes. Are there any questions from the audience?
What does a vegetarian diet consist of?
Actually, the Journal of the British Diabetic Association defines the vegetarian diet as consisting of 60% of their energy from carbs, 15% protein, and 25% fat. So in a vegetarian diet, you would gain those portions from vegetables, grains, legumes, fruits, and nuts.
What about eating small portions of meat with meals? Does a small amount of meat increase the risk?
Actually, there was a population study done among Seventh-day Adventists over a 17-year period. They found that out of 8,401 Seventh-day Adventists, those that ate meat at least once per week had a 29% increased risk of developing type 2 diabetes compared to those that ate no meat. So there's a dramatic increase there. And that concludes this presentation on the vegetarian diet and type 2 diabetes. Thank you.